Next topic for your lab would be toxicology. Let's go to the definition of terms. Toxicology comes from the Greek word toxicon and logos. Toxicon meaning arrow, poison, and logos, which means the study of or subject matter. So this is the study of the adverse effects of xenobiotics in humans. Xenobiotics, as defined by Bishop, are chemicals and drugs that are not normally found in or produced by the body. So we have different disciplines under toxicology. We have mechanistic, descriptive, and regulatory toxicology. So mechanistic toxicology elucidates the cellular, molecular, biochemical effects of xenobiotics within the context of a dose-response relationship between the xenobiotics and its adverse effects. Descriptive toxicology uses the results from animal experiments to predict what level of exposure will cause harm in humans, and then for regulatory, the combined data from the mechanistic and descriptive are used to establish standards that define the level of exposure that will not pose a risk to public health or safety. So, bali, ang regulatory toxicology ninyo are used to form regulations against the xenobiotics. The descriptive toxicology uses animal experiments. So since dili mo ta makabuhat og human experiments to define kung unsa ang lethal na effect sa kanang mga xenobiotics in humans, so we use animal experiments. For your mechanistic toxicology, it is more on the cellular, okay, the dose-response relationship between the xenobiotic and its effect. We also have specialties within toxicology. We have forensic, clinical, and environmental. So forensic, syempre, concerned with the medical and legal consequences, usually ginagamit for situations such as cause of death. Clinical toxicology focuses on the relationship between the xenobiotics and disease states. So ang focus niya is not only on the diagnosis but also sa therapeutic intervention. And the environmental toxicology elucidates the evaluation of environmental chemical pollutants and their impact on human health. Now let's go into your xenobiotics, poisons, and toxins. Xenobiotics, like we said earlier, are chemicals and drugs that are not normally found in or produced by the body. They are also defined as exogenous substances or agents that can have an adverse effects on an organism, and often used to describe environmental exposure or chemicals or drugs. So these would include environmental drug exposure would include antibiotics, antidepressants. Chemical exposure would include perfluorinated brominated compounds, or PFCs, such as PFOS, PFOA, and PTFE are found in non-stick coatings of pans, and so some of the chemicals can also be found in your drugs as well. Poisons, on the other hand, are also exogenous agents, but they have an adverse effect on biological system. So this term is more often used when describing substances that comes from animals, plants, minerals, or gas. So, for example, would be the venoms from poisonous snakes, or those from the carbon monoxide poisoning coming from the smoke or gas within the room, in an enclosed room or space. Okay, so in the form of gas, form of coming from the animals. Toxins naman, they are endogenous substances biologically synthesized either in living cells or in microorganisms, okay, such as your Clostridium botulinum or botulinum. So they come from living cells. Okay. Your Clostridium, these are hematoxins produced from venomous snakes. Okay, and there can also be mycotoxins produced from fungus. Okay. Toxicant or toxic refer to substances that are not produced within a living cell or microorganism that are more commonly used to describe environmental chemicals. So these do not come from bacteria or fungi, okay, but they come from chemicals in the environment. Most common routes of exposure, we have ingestion, which is most often observed in the clinical setting. Okay, for most toxins to have a systemic na effect, they must be absorbed through the circulation. Okay, but those that are not absorbed from the gastrointestinal tract do not produce this systemic na effect. They have local effects such as diarrhea, bleeding, malabsorption, which may cause systemic effects secondary na to toxin exposure. Next, we have your inhalation, okay, respiratory. And then we have transdermal absorption or through the skin. Next, I mentioned also the dose-response relationship. So the dose-response relationship or the DRR implies that there will be an increase in toxic response as the dose is increased. However, not all individuals display a toxic response at the same dose. For example lang, this is not a good example, but for example lang, just to give you a clear idea, both of you can be allergic to peanuts. However, ang tolerance nimo to peanuts may not be the same as the tolerance of the other person. It might take you a whole bag of peanuts before you can, ano, or not, this is not a good example. For example, ano na lang, 1 ml of venom sa snake would cause blood clots na sa lawas. So, especially sa part sa lawas kung asa siya na ano. The more venom is introduced, the more na ang amount of venom will be introduced sa body, the faster it is for the toxic response to show itself physiologically. So, kung for example, naan yung mga 5 ml of venom na naana sa body, possible na sabay-sabay na ang kanang iyahang effect on multiple organs that would cause different na mga or major na mga blood clotting effect sa lawas nato. So the more the dose, the higher the toxic response. So if we are exposed to carbon monoxide sa garahe, for example, the more that we get exposed, for example, na-exposed to like nag-pass by lang ta once, okay, and nag-ubo-ubo na ta. If nag-stay ta dito apart for like the whole day sa garahe sa gym mall, for example, tapos wala air na nagasulod, the more na mo show ang toxic responses, syempre grabe ang iyahang binding sa hemoglobin. The more na makita ito ang response niya sa ato ang body. Okay? We have here your TD50 and your LD50. Your TD50 is your toxic dose. This is the predicted dose that would produce a toxic response in 50% of the population. Now, your lethal dose is the predicted dose that would result in death. Okay, so your TD is just a toxic response. Your LD results in death already in 50% of the population. And we also have your ED50, which is the effective dose. This would be the dose that would be predicted to be effective or have a therapeutic benefit in 50% of the population. The therapeutic index is the ratio of the TD50 or the LD50 to the effective dose. It is the ratio value of the toxic dose or the lethal dose to the effective dose. So drugs with a large therapeutic index demonstrate fewer toxic adverse effects when the dose of the drug is in the therapeutic range. Okay. The drug response relationship relates to the individual's health status as well as the changes in xenobiotic exposure levels. In Quantal drug response relationship or dose response relationship, this describes the change in health effects in a defined population. So individual, syempre individual. Pag Quantal, population na, based on the changes that happen in the exposure to the xenobiotic. Okay, acute toxicity happens if there is a single short-term exposure, chronic toxicity, if repeated frequent exposure na siya. Okay, acute toxicity na exposed lang ka sa gas sa kanang, for example, factory emission, okay, for 1 day. Chronic toxicity, you live in a house that is tapad lang sa kanan ng factory and you're always exposed for months or years in that gas emission from that factory. Acute toxicity would give you immediate toxic effects. Okay, chronic toxicity would give you insufficient to cause an immediate acute response. However, it would be related to an accumulation of toxicant. Okay, the initial management of patients suffering from acute exposure. So we have to check the A, B, C, D, E. Okay, we have to check the airway, the breathing, the circulation, disability, as well as the exposure. So in the analysis of toxic agents, we have the screening test, which is usually simple, rapid, and qualitative, and the confirmatory test is usually quantitative. For your screening test, they detect the presence of specific substances or classes of toxicants. And your confirmatory test, given na kanang ano siya, quantitative, they report the concentration of that particular substance. So your screening test is a good analytic sensitivity, but lacks specificity. Since screening lang man siya, so it can be sensitive to the presence, but not specific. It does not tell you kung unsa jud ang present. However, kung confirmatory siya, it tells you what is present and how much is present, since quantity na siya. Gas chromatography with mass spectrometry, or your GC or GCMS, is the reference method for quantitative identification of most organic compounds. Other compounds would be your liquid chromatography with tandem mass spectrometry, which can be used for the quantification of various analytes in biological matrices and has the potential to replace immunoassays in screening procedures. We could also use inductively coupled plasma, mass spectrometry, or atomic absorption, which can be used for the quantification of inorganic compounds. So, pag biologic matrices, naata sa LC-MS-MS. Pag inorganic, naata sa ICP-MS or AA or AES. We could use nuclear magnetic resonance spectroscopy, which is widely used for the structural elucidation of organic and inorganic compounds and has found utility in the search for new biomarkers for the clinical laboratory. Okay, biologic would be your LC-MS-MS or your and then your inorganic would be your ICP-MS or your atomic absorption. And for both organic and inorganic, we could use the nuclear magnetic resonance spectroscopy. Okay, for the toxicology of specific agents, first let's go into alcohol. Diba we have different alcohols? You have ethanol, isopropanol, or methanol, and other namang alcohols are butanol, and diba na-mention ninyo na sa inyong histopathology. We have the effects of alcohol exposure. It could be from disorientation, confusion, and euphoria, and could progress up to unconsciousness, paralysis, and even death. The usual pathway of alcohols is from alcohol, mag-work ang alcohol dehydrogenase to produce an aldehyde, and this aldehyde will be catalyzed by aldehyde dehydrogenase to produce acid. Okay. So, one of the most common na ginaano sa atoa, na we are exposed to would be your ethanol. Okay. Excessive consumption of your ethanol or your ethyl alcohol with its consequences is a leading cause of economic, social, and medical problems throughout the world. Your fetal alcohol syndrome may occur when there is consumption of ethanol during pregnancy. So makakita taog small na palpebral fissures, okay, low nasal bridge, so pango, upturned nose, okay, there is thin vermilion border, smooth philtrum, diba usually naaman na yung murag, ano dire, kanang indentation, underdeveloped jaw, flat mid-face, okay, epicanthal folds here, okay, railroad track ears, and small, medyo small ang head. Okay? So that would be indicative of fetal alcohol syndrome or pag nag-inom ang mama o alcohol while pregnant. Okay, laboratory findings, blood alcohol concentration of 80 mg/dL is the statutory limit for operation of a motor vehicle. Okay, this concentration is associated with a diminution of judgment and motor function. Okay, the uses of when we measure the blood alcohol concentration is for the litigation of drunk driving cases, especially in the US when you have a DUI, diba? Driving under the influence. Most affected organ would be the liver. In relation to chronic use, okay, starts with the accumulation of your lipids in the hepatocytes and may progress to alcoholic hepatitis. Liver cirrhosis progression is also common. So cirrhosis of the liver is characterized as the fibrosis leading to functional loss of hepatocytes. Okay. So for your ethanol, diba, we have your alcohol dehydrogenase going to ito aldehyde worked on with the aldehyde dehydrogenase or your ALDH, and then it will form the acetate or acetic acid. Next, we have your methanol, which is a common laboratory solvent that is found in many household cleaners as well. Diba, mara ginagamit ito ni sa hima na staining. So it is metabolized by your hepatic ADH or your alcohol dehydrogenase, and which is an intermediate. It forms the intermediate formaldehyde, and the formaldehyde is converted into formic acid by the hepatic na ALDH. So the formation of formic acid causes severe metabolic acidosis when so pag naka-ingest ani it could lead into severe metabolic acidosis, which could lead to tissue injury and possibly death. Okay, the formic acid that is formed here is also responsible for the optic neuropathy that can lead to blindness. That's why ginaingon na dapat careful ta when we handle methanol because it could lead to blindness. Okay, next we also have your isopropanol, also known as your rubbing alcohol. Okay, isopropanol is worked on by your alcohol dehydrogenase to produce acetone. Acetone has a long half-life and can result in intoxication kapag ma-ingest na to siya or ma-intoxicate with isopropanol. That can result into severe acute phase ethanol-like symptoms that persist for an extended period because gani na ay long half-life ang atoang acetone. Okay, ethylene glycol naman is a common component of hydraulic fluid and antifreeze. The ingestion can be seen in individuals with alcohol use and dependency issues as well as children because of the sweet taste. Okay? So, going to aldehyde gihapon siya to produce oxalic glycolic acid. Okay? The formation of the acid can still produce severe metabolic acidosis. And high level of consumption can form calcium oxalate, CaOx. Okay? Diba makita natin na sa UBF na to, we can see CaOx and also crystal formation in the kidneys, which could cause renal tubular damage. Okay? In the analysis of alcohol, acceptable specimen would be your serum, plasma, whole blood. Okay, venipuncture must be cleaned with alcohol-free disinfectant, and specimen must be capped at all times. Sealed specimen can be refrigerated or stored at room temp for up to 14 days without loss of ethanol as long as it is remained sealed. Okay, stored properly. Non-sterile specimens should be preserved with sodium fluoride. Okay, the analytic methods can be osmometric, chromatographic, or enzymatic method, and the screening test would be the serum osmolality. Diba? We can have different methods of testing for the osmolality. Remember, pagtaas ang osmolality meaning mas concentrated ang atoang blood. or ato ang serum. Confirmation test would be your gas chromatography with flame ionization, that is for your ethanol and ethylene glycol, and just gas chromatography for your methanol and isopropanol. Next is your carbon monoxide. Carbon monoxide is produced by incomplete combustion of carbon-containing substances. They are odorless, colorless, tasteless gas that is rapidly absorbed into circulation from inspired air. Inspired air meaning inhaled. Katong air nag-inhaled na to. Gi-inhale na to. Primary environmental sources would be the gasoline engines, improperly ventilated furnaces, okay, or wood or plastic fires. Okay. It binds to hemoglobin to form carboxyhemoglobin. Now, this carboxyhemoglobin, or your carbon monoxide, has the affinity for hemoglobin 220 times to 225 times greater for oxygen than for oxygen. If inhaled, 0.1%, even 0.1%, it would result in a 50% carboxyhemoglobinemia. Okay, that's how little ang needed just for the 50% carboxyhemoglobinemia to occur. And the only treatment for this is for you to get 100% na oxygenation. The half-life in patient with normal respiratory function could be as long as 60 to 90 minutes. Half-life pa lang na. Screening method is your pulse ox or your pulse co-oximetry. Atong murag na ay laser na ginagamit for na ginabutang sa ato ang index finger. Quantitative assays would use differential spectrophotometry or your gas chromatography, but the reference method will be the gas chromatography. The most common method used for your carbon monoxide would be your spectrophotometry. Caustic agents for this would be found in many household products and occupational settings. It can either be a strong acid or alkaline substance, but the greatest hazard would be through aspiration or through inhalation. And ingestion. Ingestion can cause lesions of the esophagus and GI tract and can produce perforations or can mga ulcerations. Okay. Next, we have your cyanide, which is classified as a super toxic substance that can exist either as a gas, in a solution, or in a solid form. Okay, the mode of exposure could either be inhalation, okay, since maka-occur siya as a gas, through ingestion or transdermal absorption. This is used in many industrial products, compound of some insecticides and rodenticides, and produced as a pyrolysis product from burning of some plastics. So cyanide is actually a common suicide agent since gamay lang jud ang need nimo in order to produce a toxic effect or lethal effect sa imong body. It expresses toxicity by binding to the heme iron, and there would be rapid depletion of the cellular ATP, which is used in many na mga functions of the cells, diba? The phosphate, the ATP. Okay. Low-level exposure would give you headaches, dizziness, and respiratory depression, and greater dose exposure would give you seizure, coma, and death. Half-life niya is same as your carbon monoxide, 60 to 90 minutes in patients with normal respiratory function. Evaluation requires a rapid turnaround time. Most common method would be your ion selective electrode or photometric analysis. Chronic low-level exposure can be screened through urinary thiocyanate concentration, and other lab presentation could be high blood lactic acid levels. Okay? So, anong lactic acid levels, di ba? Nagababa na ang oxygenation sa tissue or sa cells. So, nagataas ang conversion sa ang pyruvate into lactate or lactic acid. So, nagataas na ang blood lactic acid levels, which means there is hypoxia sa ang cells and our cells are dying. Okay. Okay, after cyanide, we have your metals and metalloids. First, we have arsenic. Okay, clearance is through renal filtration. Okay. However, your fish arsenic can be cleared in urine within 48 hours. The half-life is close to 10 hours, and 70% of your inorganic arsenic is cleared in urine. Low-level exposures can give you fever, anorexia, or gastrointestinal distress. High-level exposures can damage the nervous system, have renal effects, hematopoietic effects, vascular disease leading to death, and analysis can be either through atomic absorption spectrometry, spectrophotometry, or your ICP-MS. Okay, and 90% of arsenic are recovered in the urine within 6 days. So, ang clearance niya sa urine is kanang 6 days. Okay, so arsenic, we can see the Meese lines on fingernails, kaning mga white lines here. Okay, these are Meese lines na makita sa ato ang fingernails. For cadmium, these are metal found in many industrial processes, which ang main use niya is the electroplating and galvanizing. It is a pigment found in plants and plastics and is the cathodal material of nickel cadmium batteries. Tobacco leaves also accumulate cadmium from soil. Thus, common route of human exposure would be regular tobacco use. Ang clearance of cadmium is very slow. It has a half-life of 10 to 30 years. So, dili lang siya 60 to 90 minutes like ang katong toxic na mga ano. But it has a 10 to 30 year na half-life. So, 70% of the, so wala na ako na-change. Cadmium still cleared sa urine. Could be analyzed through AAS or whole blood or urine. And associated siya with renal dysfunction, parathyroid dysfunction, vitamin D deficiency, okay, and itay is a disease characterized by severe osteomalacia and osteoporosis from long-term consumption of cadmium-contaminated rice. Okay, because na renal dysfunction and parathyroid dysfunction and vitamin D deficiency, so there is malabsorption as well in terms of your calcium. So since calcium is being affected by the amount of cadmium and the amount of dysfunction in both your parathyroid and vitamin D, so ang affected should, and 90% of our calcium is nasa tong bone, di ba? So there would be severe na bone damage, severe osteomalacia, as well as osteoporosis from long-term consumption of cadmium contaminated rice. So that's itay-itay. Osteomalacia can look something like this. Okay, so naga-bend outwards ang ato ang bones. Next, you have your lead. Lead is a byproduct of component of many industrial processes, common constituent of household plants before 1972. There was also a long-term utilization of leaded gasoline, lead-based paint, diba? And lead-based construction materials resulted in airborne lead, contaminated soil, and leaded dust. Susceptibility to lead toxicity is primarily dependent on age, and it is distributed in two compartments, either through the bones, which is the largest pool, and also the soft tissue. Okay, clearance niya is through the renal system gihapon, and an acute exposure would give you abdominal neurological symptoms such as encephalopathy, characterized by cerebral edema or ischemia. If the severe lead poisoning, there would be stupor, convulsions, and coma. Low-level exposure would have behavioral changes, hyperactivity, attention deficit disorder, and decrease in IQ scores, and high-level exposure would give demyelinization of peripheral nerves, resulting in a decrease in nerve conduction velocity, anemia, hypertension, cancer, and birth defects. The most noteworthy toxic effect of lead is on vitamin D metabolism, which eventually leads to changes in the bone and calcium metabolism. Another effect is the inhibition of the heme synthetic pathway, which causes anemia. Which is why, since we have a lot of buildings in the US that have stood the test of time, and they have those lead-based paint and lead na mga construction materials in bridges, di ba? The more na nag-old na ang place, the more na ano na, nag-deteriorate na ang katong mga paint, katong mga materials. So, nag-turn into dust na sila, and those lead dust spreads into the air and is being inspired or kanang inhaled by several people or ingested, depende. And so, it causes either ang kaning mga low-level exposure effects or high-level exposure effects in the people who are exposed to the lead. Okay. Normal threshold for blood lead levels would be 3.5 microgram per DL, and growth deficits in children with um, blood lead levels could be seen if more than 3.5 na ang level, and anemia would occur already at 20 microgram per DL. Blood picture of patient with lead poisoning, di ba? Sa Tonghima, there is basophilic stippling in the RBCs, which is a key indicator of lead poisoning. Screening methods for your lead, we have RBC protoporphyrin, chromogenic methods, X-ray fluorescence, and the standard confirmatory is through ICP-MS, which can detect levels as low as 0.1 microgram per DL. Okay, so we can see here, kaning mga basophilic stippling of RBCs. In the US, even until now, they are still checking babies for their blood lead levels, actually, as well as those na coming from Latin America or coming from Mexico, coming from the border. They check those people they do a spot check or kanang T-spot or TB T-spot na test, okay, to check for TB levels as well, and also lead levels. Next, we have mercury, which exists in 3 forms. It could be elemental in liquid, which is liquid at room temperature, inorganic salt, or component of organic compounds. For elemental mercury, it can be ingested without significant effects. For cationic mercury, it is moderately toxic, and organic mercury is extremely toxic. Okay? The common reason for toxic levels is because of inhalation and accidental ingestion. And the major source of exposure is consumption of contaminated food. Primary factor to determine toxicity is the gastrointestinal absorbance. Ingestion of moderate amounts can cause severe bloody diarrhea due to ulceration and necrosis of gastrointestinal shock, which would lead to shock and death. Ang clearance sa mercury is very slow because of its half-life of about 2 months, but not as low as cadmium, diba? Or as yeah. So low-level exposures would give you tremors, behavioral changes, mumbling speech, or loss of balance. High-level exposure would give you hyporeflexia, hypotension, bradycardia, renal dysfunction, and analysis can be through atomic absorption spectrophotometry of the whole blood or the 24-hour urine aliquot. Next is going to sa ang mga pesticides. So pesticide, these are substances that have been intentionally added to the environment to kill or harm an undesirable life form. Okay? Ilan ang mga undesirable na mga life forms? Okay? Major route of exposure would be contamination of food, because usually gina-spray man siya sa mga plants na, like for example sa mga palay, anak, diba, or kanang mga plant-based na mga food. And then most prevalent would be the insecticides such as your organophosphates, carbamates, and halogenated hydrocarbons. Organophosphates would be the most abundant, responsible for 1/3 of all the pesticide poisoning. The organophosphates and carbamates, they function by inhibiting acetylcholinesterase, which is an enzyme present in both insects and mammals. Your acetylcholine, okay, is a neurotransmitter found both in central and peripheral nerves and is responsible for the stimulation of muscle cells and several endocrine and exocrine glands. So, syempre, kung affected ang endocrine and exocrine glands na to, how can we release ang katong mga hormones that are necessary for life? Diba? And of course, ang kanang mga muscle cells na to, what about our heart? If gina-inhibit niya ang katong neurotransmitter that is responsible for the stimulation of those na mga functions sa atong body. So it's very kanang life-threatening kung ingest or magka-high level exposure ta ani organophosphate and carbamate. Low level exposure of your organophosphate can lead to salivation, lacrimation, involuntary urination, and defecation. Since wala na tay control sa mga exocrine glands na to, kanang mga nag-secrete na mga glands na to. So, di na to makontrol atong pag salivate, ato ang pagluha-luha, na to makontrol atong muscles. So, involuntary na ato ang urination and defecation. Kanang pag nag-hiintay-tay na dira, hindi mo makontrol. Pag even this is just at low level exposure. High level exposure could already give you bradycardia, muscular twitching, cramps, apathy, slurred speech, behavioral changes, death due to respiratory failure, and common used screening test would be your serum pseudocholinesterase activity and symptoms associated with organophosphate toxicity would give you 40% reduction in that particular pseudocholinesterase activity. Confirmatory test for your organophosphates and carbamates would be through your GC or your liquid chromatography tandem mass spectrometry. Toxicology of therapeutic drugs, we have your salicylates. First, we have your acetyl salicylic acid, also known as your aspirin. It's a commonly used analgesic, antipyretic, and anti-inflammatory drug, which decreases thromboxane and prostaglandin through the inhibition of the cyclooxygenase. Therapeutic range of your aspirin as an analgesic is 2 to 10 milligrams per DL, and as an anti-inflammatory, it is 10 to 30 milligrams per DL, and toxicity would occur pag nag-exceed na kaog 50 milligrams per DL. So those people who take kanang fistful of aspirin can already experience toxic effects. And because it is an acid, excessive ingestion is associated, of course, with metabolic acidosis. Salicylate is also a direct stimulator of the respiratory center, and hyperventilation can result in respiratory alkalosis. Okay? Diba? Pag kanang nag-hyperventilate ta, grabe ang oxygen, and grabe po na pagawas po na to ang kanang acidic na CO2. So, mas naga-basic ang sa daga ng get to conserve ang bicarb. So, nag-respiratory alkalosis ta. So, the combination of the two effects causes a mixed acid-base disturbance sa ato ang body. Salicylates also inhibit the Krebs cycle, okay, resulting in excess conversion of pyruvate to lactic acid, diba? We just talked about that. Since gina-inhibit niya ang katong Krebs cycle, walay formation of pyruvate or walay conversion of pyruvate to acetyl-CoA to produce the 38 moles of kanang tawag ani ATP. And so pyruvate is converted into lactic acid. There is excess NADH and only 2 moles of ATP is produced. Technically, producing or kanang demonstrating loss of oxygenation sa ato ang cells, which would eventually cause cell death. High levels of exposure to these salicylates stimulate mobilization and use of free fatty acids, resulting as well in ketone body formation that could lead to metabolic acidosis due to, diba, we have your ketoacidosis. That may also lead to death. So there are many toxic effects of sa ato ang salicylates if we take it in more than what is allowed na dose. Quantitative determination can be done through gas chromatography or liquid chromatography, which is high in specificity and sensitivity. Common method would be through the Trinder reaction. It's a chromogenic method wherein the salicylate reacts with the ferric nitrate to form a complex that is measured spectrophotometrically. Decrease in absorbance in proportional to the concentration of salicylate in the patient sample should be observed, and the enzymatic method would use the salicylate hydroxylase. Next, we have your acetaminophen, diba? Also known as your paracetamol here in the Philippines. In the US, it is known as your Tylenol. Okay, it's a pain reliever, fever reducer. Okay, so here in the Philippines, it is known as your paracetamol or Biogesic. This pain reliever, analgesic, and fever reducer, antipyretic. Okay, acetaminophen, also known as your paracetamol, is commonly used analgesic drug. In healthy subjects, therapeutic dosages have few adverse effects. Overdose is associated with severe hepatotoxicity, okay? Meaning very toxic siya sa ato ang liver. Okay, it binds with high affinity to proteins, which would lead to low free fractions and would lead to minimal renal filtration. Most is eliminated by hepatic uptake, biotransformation, conjugation, and excretion, and rapidly cleared from the serum. And so nomograms are available that predict hepatotoxicity based on serum concentration of acetaminophen at a known time after ingestion. Okay, so ang pathway of concern, which would be the hepatic mixed function oxidase system. So acetaminophen is transformed to reactive intermediates, which is conjugated with the reduced glutathione. Okay, the reference method for quantitation would be high-performance liquid chromatography, which is not widely used in clinical laboratories. So ang most commonly used is the immunoassay through competitive enzyme. So competitive enzyme immunoassay is based on the competition between the drug in the sample and the drug labeled with the enzyme for antibody binding sites. Pag mag-decrease ang activity sa enzyme upon binding to the antibody, the drug concentration in the sample can be measured in terms of enzyme activity. Siya. Toxic na siya pag more than 150 milligrams per ml, mag-show siya 4 hours after ingestion. So therapeutic levels are only nasa 10 to 30 micrograms per ml. That is why you have to follow kung saan nakabutang sa mga product inserts sa inyong mga drugs na ginatake. They have dosages there for a reason, because overdose can be detrimental to your health. Okay, that is it for the part 1 of your toxicology, therapeutic drugs. Okay.